Diabetes is a disease affecting over 500 million people worldwide, and the number is steadily rising every single year. Despite being rampant in many places around the world, most people are only really aware of the physical effects of the condition. Along with causing physical issues, diabetes can also cause mental issues due to the psychobiological relationship found between the mind and the body. Diabetes creates a number of physical effects within the body that can leave someone feeling mentally unwell. Many of these effects can be linked to changes in blood sugar levels. Fluctuating blood sugar levels can cause lack of energy, motivation, and as well as irritability. Even without having a direct physical link to diabetes, mental issues can still arise due to the condition. Studies have shown that diabetics are 2 to 3 times more likely to be diagnosed with depression than non-diabetics. Along with depression, anxiety and stress are more likely to crop up as well. These issues can be compounded into keeping someone from getting treatment for their conditions, both diabetes and its mental effects.
Diabetes is a health condition that affects on how our body turns food into energy. It occurs when our blood glucose, also known as blood sugar, is too high. Diabetes can and cannot be hereditary. It might be inherited and linked to our family history and genes, but environmental factors also plays a significant role. Not everyone with a family history of diabetes will get it, but more likely, there's a higher chance to develop it. Diabetes can affect a person's mood or behavior. Mood swings such as anger, sadness, tiredness, nervousness, anxiety, aggression, irritability, and many more are some of them. Our blood sugar impacts on how we feel, and it can contribute to our mood swings. Diabetes can sometimes cause temporary changes in personality and behavior of a person. It can lead to strong emotion and behavior, but with regular exercise, taking medication, and right diet, it can somehow be manageable.
The severity of diabetes symptoms varies depending on how high your blood sugar is. Symptoms of type 1 diabetes tend to appear quickly and are more severe. Type 1 diabetes is more common in childhood and adolescence, while type 2 diabetes, which is the most common, can strike at any age. It is more common in people over 40. The exact cause of type 1 diabetes is unknown. What is known is that your immune system, which normally fights harmful bacteria or viruses, attacks and destroys your insulin-producing cells in the pancreas. This leaves you with a little or no insulin. Instead of being transported into your cells, sugar builds up in your bloodstream. Weight is not believed to be a factor in type 1 diabetes. Prediabetes and the type 2 diabetes can be caused by a variety of factors. Your cells become resistant to an action of insulin prediabetes, which can develop into type 2 diabetes.
Types of diabetes. There are 3 main types of diabetes. Type 2 is largely diet-related and develops over time. Gestational diabetes is high blood sugar, glucose that develops during pregnancy and usually disappears after giving birth. It can happen at any stage of pregnancy but is more common in the second or third trimester. Effects of diabetes on human behavior. Changes in blood sugar level can affect a person's mood and mental status. When blood sugar returns to a normal range, these symptoms often resolve. Fluctuation in blood glucose can result in rapid mood changes, including low mood and irritability. The person with diabetes often experiences that they are always thirsty, they are always hungry even they just eat, they are always dizzy, they also always experience that they cannot breathe, and they are sometimes hot-tempered even in small things.
The effect it has on behavior relies on insulin. If the individual has type 2 diabetes, his/her body needs more insulin to get the same effect because his/her body resists. Behavior may vary, no consistency may be today. she friendly to others and willing to help them because her body glucose level is normal. The next day, she's upset and couldn't stay focused because she couldn't control her glucose level. After many years of overproduction, the insulin producing cells in the pancreas burns out and it affects behavior over time as a result.